Good afternoon, and welcome to the Flint Community Webinar on Coronavirus. We are week 119. It is June 24th, 2020, and we are so excited that you joined us today. Looking forward to an extraordinary session today. This webinar is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Over these 119 weeks, we've been fortunate to be able to partner with so many community organizations to bring this local context to our global pandemic. I'm your moderator today, Yvonne Lewis, and I look forward to helping facilitate this session today as the co-director of the Healthy Flint Research Coordinating Center. As I mentioned, we have a number of community partners who join us every week to be sure to answer questions that you might have. And I want to just give a shout out to some of those partners for today. We want to make sure that you know we have Genesee Health Systems here, our mental health provider, to share information with us, our Genesee County Health Department. We also have with us today the Genesee Health Plan, along with representatives from Michigan State University, the University of Michigan, Ann Arbor, and the University of Michigan Flint. We are looking forward to hearing some exciting information today we want to share with you. There have been some late breaking information about some of the community issues. We talked about it a little bit on last week about some environmental concerns. We're going to give you a highlight on that. We have a special guest today with us, Grant Trigger, who is going to be giving us an update on that. We'll have our medical moment. And of course, we'll get some updates from both the Genesee County Health Department, the City of Flint, and our data update will be available for us today. So we want to get right into our session today, and we're going to talk to Grant Trigger. Grant Trigger is from Racer Trust. He is the manager of the Michigan Cleanup. And so we're excited to have him on with us. He's going to give us a little bit of an update about what's happening at the Buick City property. Now, remember, we talked to you last week that there was some information about an oil spill in the Flint River, but we wanted to make sure you understood that was not from the property at Buick City that we were talking about. This information is going to just give you an update on what's happening with that redevelopment project. Many are asking those questions, and so we want to share a little bit of that with you today. Grant, welcome.
Thank you, Yvonne. I'm glad to be with you this morning. If it works, I'll share the screen. Did that come through?
Yes.
Very good. Well, it's a pleasure to be here this morning. I wanted to comment a little bit about my background and why I'm involved with the Racer Trust. I'm a native of Michigan and both an environmental engineer and environmental attorney, and had the opportunity to join the trust after the GM bankruptcy. The trust was created in March of 2011 out of the GM bankruptcy by an order of the New York Bankruptcy Court. At the time the trust was formed, we had the third largest industrial portfolio in the United States, 7,000 acres of industrial land, 44 million square feet in 14 states across the eastern US, 52 properties in the state of Michigan, 36 with individual cleanup budgets totaling over $155 million. So you can tell that the footprint of General Motors in Michigan has always been large. And so after the bankruptcy, the properties that were left behind were significant, not the least of which, in fact, the largest site we have is the former Buick City site. The trust is unique in that it was provided with a dual mission. The trust is an environmental response trust, and there have been other environmental trusts created across the country, but this is the first time an environmental trust was created with a dual responsibility: clean up and position the properties for redevelopment. So our success is measured both by achieving cleanup and achieving redevelopment. And to date, with respect to our Michigan properties, we have over 9,000 jobs that have been created associated with the buyers who invested on our properties, and almost $1 billion in investment in total. There's much more to be done, though, however. With respect to the Buick City site, and I'm going to give you a general overview. There's a lot more detail, but we'll come to that at a later time. This is a general illustration of the Buick City property, which you see marked out in the dark black dotted lines. 2 miles long north to south, from Hamilton on the south to Pearson Road on the north. And we've sold several parcels. At the far north end, we sold property to American Spiral Weld. If you come across Stewart, you'll see on the north side of Stewart a whole lot of steel pipes wrapped in blue. That's the product from American Spiral Weld. And the southern portion of the site, south of Hamilton Avenue, we sold property to Lear. They bought the property, went up operating in about 18 months. Very quick result, very good result for us overall, and good for the city. There was about 450 jobs created at that location. This illustration that you have in front of you by color represents different stormwater lines that service the site. And where you see colored area outside of those dark black dotted lines is property not owned by GM or the Racer Trust, but is city property or other property. So you can see there's an intermix of these stormwater lines. And to Yvonne's earlier point, the spill that hit the river about a week ago, actually, I think it's about a week ago today, came out outfall 001, outfall 1. That's at the far north end of the property. We are not connected with that release at all. It just shows you that other people use these same storm sewers that we do. I wanted to talk a little bit about one project we're working on right now. It's active. We're literally doing work right now. And that's an area along James P. Cole. There is a lagoon in that area. In March of 2021, not long ago, we found PFAS in the water in that lagoon, and we had to determine what we were going to do about it. So what we're currently doing, and if you drive by this, you'll see some work going on, but something you can't see from the road. This is a shot of what the lagoon looks like. James P. Cole is along to the far left in this photograph, and you can see these blue vessels. That is a water treatment system. We're pumping water out of the lagoon through these treatment system into the city storm sewer. At the same time, you can see a truck and a bulldozer on the other side. There's excess dirt generated off the rebuild of I-69. That excess soil is coming to the site to help with redevelopment and remediation. The soil that's coming and being stockpiled there will be used to backfill this lagoon once we've treated the soils in the lagoon. So you can see all this going on in this one photograph. And a closer look up of this treatment system. This is an activated carbon system. The water gets pumped out of the lagoon, pumped through these vessels and treated for PFAS before the water is discharged to the city's sanitary sewer system. So that's one piece of activity that's going on the site. There's much more, and we'll get to, I'll mention that in just a minute. But one thing I wanted to comment on, because Yvonne and I have had this conversation, that some concern in the community about PFAS being airborne. There has been some national research done on this. There have been some studies that reported that you can find PFAS all across the country, including in the Upper Peninsula. And it's believed, for example, in portions of the Upper Peninsula, it probably traveled through the air. So there is air transport of PFAS. However, it's generally from manufacturing facilities, stacks. You can imagine any kind of emission, releases that come from manufacturing stacks. That's generally where we're seeing PFAS in an airborne condition. What we know now is that airborne PFAS is not considered a site remediation issue at site like Buick City. I mean, there's been no industrial activity here for going on 15 years. And so older industrial sites, it's not known that they are a source of airborne PFAS. We continue to follow this type of research as we do a great deal of other developing issues with respect to PFAS. And if the information we have changes at any time, we will post a notice and provide information on our website. In fact, I should have printed the address for the website. It's racertrust.org, www.racertrust.org. And we have a lot more information on the website for anyone. The other thing is we typically do public information meetings. We like to get the information of that spread. Yvonne is aware of that. We've done several interviews on our radio show to talk about this. We had one scheduled for last night, but because of potential COVID considerations, which is pertinent to your program today, We rescheduled that. We were going to do it in person at the Dome. We reconsidered that, and now we're going to do it fully virtual on July 14th. There'll be more details on that published. In fact, we're meeting on July 1st to go over the logistics for that program. And that program, we're going to cover a lot more of the activity that's going on at the site, the things that we're doing about PFAS, in which we're trying to, as I said before, not only perform the cleanup, as position the site for redevelopment. We do have a buyer who has signed an agreement to purchase the remaining 350 acres of the site. And we're working very closely with them to get them the information they need to complete their analysis and in fact, close on the property. A key aspect of the trust is that post-closing, after we sell the property, American Sparrowell to the north, Lear to the south, we continue to follow through on our responsibilities to deal with the legacy contamination. So if we sell the remaining property, we're still going to be here. We're still going to be here dealing with our environmental issues because that's the long-term responsibility of the trust. So that's kind of a big overview, Yvonne. I'll pause there. As you know, I'm capable of speaking a much longer period of time, but I thought for this morning, given the primary focus on COVID, that would be a good little highlight. And add one footnote. I have 3 granddaughters under 5, and I'm hoping they can get the young COVID vaccination soon. And so with that, I'll pause. And if there are questions, other things, I'm happy to have a chance to share some of this morning.
Well, thank you so much, Grant. We're going to ask our participants if they have questions, they can put them in the queue for the Q&A, or put them so that you can respond to those questions. But we just want to thank you for coming, because when questions come up for the community, we said this is the Flint community webinar on coronavirus, but we know other issues are facing our community as well. So we appreciate you coming today and responding to the questions about what's happening at the site and how you're continuing to do the work necessary to make sure it is environmentally safe for us as a community, and offering some opportunities for additional industry to come into the community. I know you're working closely with the city of Flint on that. So July 14th, you'll be back and we'll have more information to make sure our community is aware of that. So Grant, thank you so much for being with us today, and please stay on. So if those questions come up in the queue, we can be able to answer them.
Very good. Thank you, Yvonne.
You're welcome. You talked about the children being able to get vaccinated. We're going to talk about that in a little bit. But this webinar has been going on now, as you know, this 100+ weeks. My goodness, we didn't know we would be here this long. But I want to just give some of our partners for 119 weeks to come on and join me. Dr. Deborah Furholden's been with us. Dr. Wolford has been with us as well. And I want to invite them to a little conversation. And for all of those that you're here today, just this is a special day for us. It's what some might say it's a little bittersweet because Dr. Deborah Furholden is one of our stellar community members who has now moved, and we talked about this a little bit before, to New York University. She is the Dean of Global Public Health for New York University. So Dr. Deborah, thank you for joining us today.
Thank you, Yvonne. And even though I'm in New York, I'm literally sitting in my kitchen in my New York apartment. You can see the New York skyline out my window, maybe. I'm still a forever partner with Flint, forever, forever, forever.
Yeah, so we have a little something we want to show you today. And so this is our Dr. Deborah.
Oh.
We want to say congratulations, Dr. Deborah Furholden, Dean, New York University School of Public Health. And we just want to give you some reminders of some of the time that you spent with us. We know you're not going to leave forever, but we just want to send you some reminders. And this will also give us an opportunity to remind some of our community when we talked about trusted, credible voices from right here. This is what it looks like. Dr. Deb, take a look.
Welcome to the Flint Community Webinar on coronavirus. So SARS-CoV-2 is a novel virus in the human population. It is new to us. How I want people to think about it is it's now just with us, right? So it's with us. It's here to stay for some undetermined amount of time. It's now with us. What I don't want people to do is throw their hands up in the air and accept the outcomes that we've had to date. There are things outside of the individual that will shape and influence their health and their health behaviors and their opportunities for optimal health. Not everything about somebody's health and health behavior is their own fault. There are things about systems and structures and policies that are important drivers of health outcomes. Those are the inequities, the upstream factors, the systematic things that unfortunately are baked into our society. I think there is a bit of a rush to normalcy, but unfortunately, while we might be over COVID, COVID is not over us. This is the kind of thing where the goal is not to sort of brush it off and pretend as though it's not a big deal. The real goal here is to prevent people from getting sick in the first place. And I think there's a better balance between how do we take what we know works as far as prevention, both at the individual level and then at a community and a system structure policy level, and get all those things activated so that people can be more engaged in their world, but also not unnecessarily placed in harm's way. This is week 76. Who knew back in 2020? But I just am thanking God for this platform and this forum and all the people who participate. I feel good about the work that we've done, both at the state and the local level, and giving people good information to keep them safe. So I just ask people to keep doing the right thing. Biggest thing that I really want people to do is continue to be an advocate and a champion for people in their lives.
Thank you, Dr. Deborah. Now hold on. We got one more something for you to see.
Hello, my name is Sheldon Neely, and I serve as mayor of the great city of Flint. Today is a little bittersweet. I'm here to congratulate and also say goodbye temporarily to my friend, Dr. Deborah Furholden. When we think about triple threats, we think about movie actresses, dancers, and singers, but she is definitely a triple threat. She's beautiful, educated, and intelligent, and she's a burst of power and positivity for this community. Now that she takes her talents to another place, she won't be forgotten because she still owns a home here, and you better pay your taxes. But seriously, you served on a Blue Ribbon Committee. You served as an advisor to the city of Flint going through our nationwide health crisis. You helped us close the disparity gap here inside the city of Flint. You helped us on our advisory council to the law enforcement officers, making sure that we had good policies that we have put in place. No chokeholds, no knock search warrants, advising us about police cameras. And we put those things into position, making us better and stronger. And that's what you do. And I want to congratulate you so much. And every week you have been on a phone call with me to be able to address the need for residents to protect themselves from the deadly COVID virus and the variances. Every week you have done this, and I appreciate it. I really appreciate the fact that you didn't charge us not one single penny for your expertise and your service. But that's because of the kinship. Being a Flint Northern Viking, and you also being a Flint Northern Viking, that's how we get down. So everyone else is watching this, you should have been a Viking. Deborah Furholden, Dr. Deborah, Dr. D, my friend, hey, you're always invited back to the Neely's deck party when you come back to town. Thank you guys, and God bless.
All right, so we want to say thank you to our mayor and for that little trip down memory lane. Dr. Deborah, you said some very powerful things during your little excerpts. And so I just want you to kind of reemphasize some of those things. You said COVID is with us. You know, we may be over it, but it's not over us. So what do you see now that you're in a more of a, you will be moving into more of a global space?
Yeah, so it's funny. I'm literally now on quarantine on day 3 because I had a recent exposure, a large health conference that I attend. All but one human being that I know who went to that conference contracted COVID at a health conference. We've done a lot. We've come a long way. We have better therapeutics. We know how to treat COVID. You know, our hospitals are not overburdened the way that they once were. But I just still maintain this is a preventable illness for people. And I have friends who have been knocked on their butt. I have a friend who had COVID in March and just got COVID again in June. Like, I just cannot underscore enough how important it is for people. They don't have to be in fear. This is what makes, to me, this webinar so powerful and potent. We are not fear mongers. We don't want people to be afraid. Dr. Wolford comes on and gives us the biology and the basic lessons that we wish that our high school teachers and college teachers could give. Yvonne, I just want to, you've assembled just the best group of people to communicate credible, reliable, science-based information, the best knowledge, that we have. And my commitment remains that people have knowledge and tools and power and everything that they need on their tool belt to keep them and their families safe, and also to be able to engage in our world. It can be a both and. So I'm forever a champion for Flint. Y'all still got, like Mayor Neely said, y'all still got my house. Y'all still got my 2 younger children. Here's what's crazy. Now y'all got my 2 younger children. So I went to school in Flint and my 2 children graduated from school in Flint. My son just graduated from my community college and my daughter is at U of M Flint. So I'm Flint forever. Flint versus everything.
One of the other things you did in this whole space is this webinar, HFRCC, is a partnership. And so we also want to hear from one of our partners who has some words to say and share with you. Dr. Wolford.
Thank you so much, Yvonne. Thank you for this opportunity to just give a few words of thanks, really, to Dr. Deborah. Words really cannot capture all that Deborah has meant to the HFRCC and to every one of us who have had the benefit of being in contact with her during her stay at MSU. But I just wanted to say, when I think of Deborah, I think of a dynamic doctor. When I think of Deborah, I think of an energetic, expert epidemiologist. When I think of Deborah, I think of a brilliant battler for better health. When I think of Deborah, I think of a real researcher. She keeps it real. And when I think of Deborah, I think of an awesome advocate and academic. And I just want to say, personally, I have learned so much from being able to work with Deborah. And I wish you the best in everything that you do. I know that all of your partners at U of M feel similarly. And we love that you're saying Flint forever, because we really hope that we can continue this partnership for long into the future. Deborah, thank you so much. Thank you for everything.
Thank you, Dr. Wolford. Now I'm going to be looking here in the queue. I'm going to ask our other panelists. I'm just going to ask you to open your mic or raise your hand and we'll call on you for comments. But I want to go back over here to Dr. Deborah. Dr. Deborah, something that's been really said, this team that's amassed local credible voices. And you mentioned we're not encouraging people to be afraid, but we're encouraging people to be cautious, be aware of their surroundings. So there's still many questions about COVID. And so we've got some activities going on here in the community where community voices are going to be saying that there are questions still about COVID, but we have trusted, credible voices who can respond to them.
Yeah, and I just want to acknowledge, people might not know, but the stuff behind the backgrounds is not always pretty. I've had some of the worst fights ever with some of the people on this Zoom, some of these panelists. So I just want to really honestly acknowledge and appreciate you all, because I know I'm a better leader, a better public health person, a better partner out of that. I've grown in my own patience and willingness to be kind and understanding. You know, the thing that we all share is a love and a commitment to this community. And I just appreciate being able to work with people who let their commitment be bigger than their ego. I'm better and stronger, you know, out of the work that we've done together. So I hope you all know just truly how much I tremendously appreciate the opportunity to have stood shoulder to shoulder with you and do this work.
Thank you, Dr. Deborah. I'm looking here. I don't want to miss anybody. That's any hands raised here. All right, don't want to miss. So Dr. Deborah, just a couple quick questions. The demonstrations that you've shared with us about masking, we have a community member, and many of our community members are encouraging the wearing of masks. And one says, "Don't be willy-nilly." I don't know if you're familiar with that term or not, but
Yeah.
can you speak to not wearing the mask properly? Because that when you talk about this consistent work that we need to do to be safe, just give us a glimpse again of what that means.
The only thing we've done during COVID, in my experience, is try to elevate and evolve and adapt as the virus has evolved and adapted. So we talked initially about the importance of masking. And then when the Omicron strain emerged, we realized that we needed to elevate the conversation around masks. So you needed a well-fitted and well-filtering mask. So the masks that seemed to be protective against some of the earlier strains of COVID now were less effective with some of the newer strains. So the message remains the same. When you're indoors, especially in crowded spaces, you should be masked. And now we know you need a mask that has multiple layers of filtration. And I always tell people, don't do the most. We don't want you to be so masked up that you can't breathe. I've seen people wearing 3, 4, 5 masks. That's doing the most. You just need a well-filtered mask. You can get you a KN95 mask. I order them in bulk off of a large drop ship company that I'm not going to promote here, so I won't say the name, but you can get them everywhere. They're available for free in the public. And I'll just toss the ball to some of the team. But let's make sure we put links up in the chat for people to know where they can get masks from. The city is offering them for free. You can go to City Hall, I know for a fact, and get masks for free, KN95 masks. So masking remains important. The vaccine, I cannot underscore enough, still remains one of our strongest foundational protections from preventing people from getting severely ill, being hospitalized, and dying from this disease. It has broken my heart to see how many people have gotten really ill and died from something that could have been prevented with some of these prevention measures. So that mask, those vaccines remain important foundations. And then let us never forget these things. Our hands are vectors for everything. We use our hands and interact with the world. And we also use this thing, that cell phone. This thing is also a vector. So keep your hands clean. You don't have to wash your hands 30 times a day, especially if you're at home. But when you're out in the world, keep your hands clean and be mindful of putting your hands on your face. Oftentimes people are coming into contact with COVID. It is emitted through spray, right? And we get it in the air, but also it can be on surfaces or on the elevator buttons or on the doorknobs, and people touch those things and then they rub their eyes or they sneeze or they, cover their nose, and then they've actually infected themselves. So I think knowledge is power. And I'm just really grateful for all the knowledge that we've imparted here. But the message remains the same. We just are elevating it so that we are evolving as the virus is evolving.
Thank you, Dr. Deborah. We have Mildred Hunter has from the Regional Office of Minority Health has sent a note in the Q&A about the Biden-Harris administration launching a new initiative to expand the availability of at-home tests and that are more accessible to people who are blind or have no vision or low vision. So if you want to get those tests, the number is, and you mentioned getting that information out, the number is 1-800-232-0233. For ordering the test, you can call 1-800-232-0233. And I share that because we have some folks who are listening by phone, so they can't see otherwise. So each order will include 2 rapid tests, antigen tests that are more accessible for people, again, who are blind and low vision. So those orders are free, and all you have to do is call that number while supplies last. So thank you, Dr. Mildred Hunter, for putting that information into the Q&A. So Dr. Deborah, we'll look forward to you being back with us. And as you said, you're not going away. You're just on the other side of the, I'm going to say on the other side of the river, but we're just a call away and just a Zoom away. So thank you, and we wish you well. Let me also share with you now, you mentioned some of the amazing examples Dr. Wolford has given to help us get through and understand better. So we're going to look forward to the next segment. Our next segment is Dr. Wolford with our medical moment. Any last words, Dr. Deborah?
Yes, testing, I still believe, is an important tool. And if you don't have access to a test, but you know you've had a recent exposure, or if you have symptoms, stay put. I tell people, I can't, we've probably all had the experience of you're out and somebody starts sneezing or coughing and they'll say, oh, it's not COVID. But my thing is, it's something. If you're sick, stay home. If you're sick, don't spread your germs to people. My real hope is that we also can re-elevate. See, what people don't realize is that flu pandemic in the early 1900s, that's where we really started to integrate good hand hygiene. We learned a lot, even though we didn't have all the technology and things that we have now. If you are sick or you have symptoms, even if it's not COVID, please do not spread your germs to other people. This is called just being a good citizen and being mindful and compassionate to your neighbors. You never know, you might expose somebody in a grocery store who would bring it home to their elderly grandmother. And we know how important grandmas are in our families and in our lives and in our community. So like Dr. Reynolds says, the most important layer of protection is the thing in between your two ears. So I'm just asking people, take all this good info that you've been getting over these last 2 years from us and put that stuff into play. There's no need to fear. We've got the tools, use them, and we'll be fine. And thank you all. I really love y'all. I love Flint. Flint forever.
Now, I'm going to tell you, Dr. Deborah, one thing we did early on is we always ask people to be, kind of check us. And so I'm going to ask Kiana from the city of Flint. She has an update on what's going on at City Hall regarding the mask. And so we want to get that in right now. Kiana.
Hey, good afternoon, everybody. I just wanted to make note that we have run out of masks. And so we will have to make sure that we get a shipment in, but we do not have any available at this time.
So they want to make that phone call. And also, when they go to the test to get tested, they do have free masks at the testing sites. So thank you so much. And Dr. Deborah, again, we'll be talking with you. We're going to keep you on speed dial.
I know I better stop talking before somebody else checks me on bad information, but that's why we all got to be in the same conversation. Thank you, Kiana.
All right. So let's move now to our medical moment. Dr. Susan Wolford.
Thank you so much, Yvonne, for allowing me to have this medical moment where we're going to focus on COVID in infants and young children. But in honor of Dr. Furholden, it is actually not a medical moment this week. It is going to be an epidemiological moment. So I looked back at all of our older, a lot of our older webinars, and the question came up, well, what is epidemiology? And Dr. Furholden says that people often think that she treats skin, but we all know now, right, that it's not about skin per se, and clearly we all love this picture of Dr. Furholden. So here, Dr. Furholden told us, I think it was on our 12th webinar, that epidemiology is the study of diseases and disease outbreaks. And I will just add to that really epidemiologists know the 411. They give us the numbers that we need to be able to make good decisions. So today I am focusing on numbers as it relates to children who are 6 months to 5 years, less than 5 years of age. And we want to know about why we would get them the vaccine. So let's start off, first of all, by thinking about everybody 5 years and older who have been able to get the vaccine, right? Let's think about people who have died from COVID over the last couple of years, or since vaccines were available. So we're looking back from April 2021 till now, this April in 2022. So we're looking back over about a year, and we're looking at deaths from COVID. If we look at those who got vaccinated, there are people that have died who were vaccinated, right? Everybody who doesn't want to get vaccinated will tell you, oh, I know so and so, and they got vaccinated and they passed away. And it's really, really sad that they did. And we know that while the vaccine protects people a lot, there will still be those who unfortunately will succumb to this awful disease. But now let's look at those who did not get vaccinated, and let's look at death. That black line is of deaths from people who were not vaccinated. You can see very, very clearly that not being vaccinated, particularly when levels of COVID are very high, is a much riskier business. In fact, we can see that people who were unvaccinated were 10 times, they had 10 times the risk of dying from COVID compared to those who got vaccinated. Okay, so that's for people 5 and older who could have gotten vaccinated. So now, let's think about these children, 6 months to less than 5 years of age. Now, in this setting, I think it's important for us to think about what are facts and what are fables. And so let's look at this. There are a few fables out there. First of all, that these young children don't get COVID. Well, actually, over 2 million COVID cases have been in children, the age group that we're talking about, 6 months to 4 years of age. So that fable, we can say that's a fable. It's not true. Okay? People out there say, but they don't get very sick. If they do get COVID, they don't get very sick. Well, over 200,000 children in that age group in the US have been hospitalized. So I think we can say that that's a fable, that kids don't get sick. Some of them can. While many don't, there are those who will get very sick. And then we say, we've heard it said, but they won't die from COVID. However, over 200 children have died from COVID. And so while, yes, it's more likely for you to die if you're an older person who's been ill and have COVID, certainly we can see that children 6 months to 4 years of age do get COVID, they can get very sick, and they can in fact die from it. Well, knowing that, and knowing that we have now a vaccine that is available for these young children, one would think that people would be very, very eager to protect their children by going ahead and getting the vaccine. But there may still be questions. And so what I thought I would show is looking at other vaccines. Oh, sorry, hang on a second. Let's focus a little bit on the death again. COVID is now the 5th leading cause of death for infants 1 to 4 years of age, and the 4th leading cause of death for children under 1 year of age. So you can see that it's a significant issue even for this age group. So now, what about if we compare COVID to other illnesses that you can prevent with vaccines, and how we made that decision, how we thought it was worthwhile to give children that a vaccine. So for example, let's consider rotavirus. Rotavirus causes the stomach, what we call the stomach flu. And so you kids who get it will have a lot of vomiting, diarrhea, they get dehydrated. And we didn't always have a vaccine for rotavirus. But if we think about this illness in children less than 5 years of age, and we think about the average number of deaths in the year before the vaccine was recommended, the rotavirus vaccine was recommended, there were about 20 deaths for children in this age group during that time period. And so when the vaccine became available, people thought, oh, we can save children from getting sick and spreading it at daycare and bringing it home to their parents, who then can't go to work, and also we can prevent hospitalizations, and we can prevent 20 deaths a year on average for children. And it was weighed as a very reasonable thing to give children this vaccine so that we could prevent all of those horrible outcomes. And we've been giving it now for many, many years. Children get it at 2 months, 4 months, and 6 months of age. And we have been able to prevent a lot of the deaths, a lot of the illnesses, and a lot of the missed work and all of the problems that rotavirus caused. So now let's think about COVID-19. If we look at COVID-19 in children 6 months to 4 years of age, we don't have a lot of years of data, but we can look at this, the average number of deaths in the year before the vaccine became available for them. And so when we look at that, we see there are 86 deaths. So the equation here is even clearer when we look at these numbers. If we could get kids vaccinated so we could prevent their parents, them spreading it to their parents and other people, spreading it at daycare, causing lots of missed work, preventing them from getting hospitalized, and we could prevent some of these 86 deaths, it seems like the equation is very clear that this vaccine is something that we should roll out to children 6 months to 4 years of age. So the facts are that the studies with the Pfizer vaccine showed that it's about 80% effective, that the Moderna vaccine was about 50% effective. I'm saying about because the numbers vary depending on whether we're talking about Omicron or whether we're talking about Delta, and it varies between whether we're talking about the very young children, the infants versus the toddlers. So, but the efficacy is very comparable with what we've seen in older children and adults, and that the side effects are the normal side effects that we would expect. So they will have some fever, they will have some fussiness, they will have some fatigue, but there was nothing like no myocarditis, no of those concerns that people have had about with the vaccine. That none of that was seen in this age group. And so with that, we have the 411, all the numbers on the epidemiology of COVID in these young children. And I hope that sheds some light on the topic for all of those who are trying to make the decision as to whether to give their child the COVID vaccine or not.
Thank you so much, Dr. Wolford. We appreciate that update. You said the 411 on COVID vaccines for children. Do you have an update on, I just heard they were talking about the vaccine is available?
So the vaccine is available. The CDC made the recommendation. They met last Friday and Saturday, and they made the recommendation that children 6 months to 4 or less than 5 years of age should now get the vaccine. With the Pfizer vaccine, it's 2 shots, 3 weeks apart, and then a third shot 2 months after that second shot. And then with the Moderna vaccine, it's just 2 shots, and those shots are 4 weeks apart. For most children, there's some children, immunocompromised children may need more. But those are now recommended. And availability varies because, as I say, they just made that announcement over the last weekend. So availability varies, but I imagine it's going to become more and more accessible over the next couple of weeks.
I know the health department will be able to give us some insights and updates on that when they get the information that they need. So again, thank you, Dr. Wolford, and we appreciate what you've shared with us today. And now we know we'll also get a data update from the data dashboard, the work that's being done with the University of Michigan in partnership with the Genesee County Health Department. And Alan's going to give us that update today.
Hey, everybody. Thanks for having me. It's just such a good reminder to be in these, to have these meetings and have all these people using data and science and all this background to sort of lead the way and inform our decisions. So here I am with the latest update. It appears our current surge that we're in is waning, so it's good to see those numbers going down. While this week I took the percentages of race groups and compared them. Like Mayor Neely in that video mentioned, the disparity gap had decreased. So if you remember back in the start of the pandemic, March and April of 2020, African-American cases were about 4.5 times higher than their white counterparts. Shortly after that, the gap decreased. And since then, we've been maintaining every time we get a surge, every time we get more data, we don't want to take it for granted that there's no disparities happening. So in this latest surge from the past 10 weeks, that is the case. So it's still at a much shorter race gap when comparing percentages of African American cases and white cases. So that's good news. We're going to continue to keep doing that. Additional examinations is for these next 2 weeks, I want to look at age and gender in that same way throughout the time of the pandemic, and then different geographies. So the county as a whole, city of Flint, and then sometimes I like to look at Genesee County minus Flint, just because there's different populations, different densities, things like that. And then there was a slight increase in testing positivity, and we'll just continue to keep our eye on that. Is it from my end.
Oh, thank you, Alan. Thank you so much. I thought you were going to just share one more piece of news there, but thank you. Thank you so much. So that leads us then, after that, we're going to just go right to the health department because we're looking at making sure that we know what's happening in terms of how the health department is assisting us in continuing understanding what the numbers say. So we have Ashley with us today, the Emergency Preparedness Coordinator. Ashley.
Hi all, this is Michaela, one of the epidemiologists over at the health department. Yeah, Ashley is at, she is doing some vaccine clinic plannings today, so she asked me to fill in for her. So right timely with the opening up of the age groups for our clinics. And I did put in the chat, just as Dr. Wolford was finishing up, I put in the link to the vaccine clinic schedule for the Genesee County Health Department. So the calendar is up for the remainder of June, and I believe the July calendar will go up next week. They're in the process of planning those dates. And that link that will remain the link. So if you just want to continue to check that, the July calendar will go up. And as far as what we have on the screen here, our overall cases are slowing down. We're on I believe this is our 4th week of a decrease in cases, which is fantastic to see the numbers going in that direction. Ashley did share with me just a few hospital specific updates that I will share. As I'm looking at the numbers here on my other screen, we are seeing a continued decrease of patients in all 3 of our hospitals, including those in the ICU and those on ventilators. The majority of patients, both in the ICU and on vents, are not COVID patients. They're unrelated illnesses. And so that's fantastic news. Let me just see here. It looks like at this time, there is only one PEDS patient as far as COVID is concerned, which again is fantastic to see that low number, just going right on trend with our vaccinations being able to be administered to our little ones, and just getting a higher and higher percentage of our community and of our our nation protected is really, really fantastic. And I believe that is all I have at this time. I am happy to take questions if anyone has any. And I apologize, I do like to have my camera on usually when I'm speaking, but I was just issued a new computer and the camera does not seem to want to work. So my apologies there. Oh, Yvonne, it looks like you're on mute still.
I'm sorry, Michaela, you mentioned that your calendar is on the website. You put that in the queue. We do have information about the clinics, and those clinics are still open. We just like to show those every week just in case someone is going back and looking at the webinar, they can see the information on the screen. So for June, still have those events going on. Are there any pop-ups that, like you said, there's some things going on specifically that are getting prepared for? Are there some pop-ups that you might want to share that may not have?
Nothing as far as pop-ups, as far as I know. That calendar that you have up there is the same information that I have. So it looks like everything is covered there.
So this is Joanne Herman. So this information does include our pop-ups. We had 2 pop-ups last week as we launched the little children, and we're continuing to evaluate, but recognize that anytime, especially if a parent is eager, we can make an appointment through the Genesee County Health Department as well in our immunization area at Burton.
So Joanne, while you're here, for the little ones that you're doing, are they only at Burton, or are you doing them
anywhere? I'm pleased to say that anywhere that we are, Genesee County Health Department is doing a vaccination event, that is inclusive of all the young children as well. So we had twins that were 7 months old yesterday, and we're so happy to see these families come out. And so, yes, you can assume that we are doing them 6 months and older all the way through. And we do offer both Moderna and Pfizer for the little children. We have both vaccines available for parents' choices.
And so they'll even be able to get that follow-up. And just remind us again, when they get their vaccinations, they do get the vaccine card that shows that they've gotten their vaccination, and that also goes into the Michigan registry.
That is correct. We put it right on the spot in the Michigan registry. Every parent leaves with a vaccine card. And if a parent should lose a vaccine card for themselves or for their child, we are able to look at that registry and give them the information that they need at their next clinic visit as well.
Thank you so much, Joanne. And we do want people to know if they do need that extra assistance, they can call the health department and get someone to come out to their home, as we have these vaccination sites in the clinic that are going on a regular basis. But we also want to remind them about testing and encourage that continual testing, because testing is so very, very important as well. So our testing sites at Word of Life, Bethel United Methodist Church, and Macedonia are still underway. So thank you. Any additional tips there for us, Joanne?
I would say it was wonderful to see the parents that came out this week for our clinics, and we just hope to continue to see these numbers grow. And I think besides having it available at the website and Facebook and other social media, just word of mouth can be very powerful. So I would ask each of us on this call to reach out to family and friends and remind them and let them know that it's available in Genesee County.
Thank you so much. And so we'll go now. Thank you for the update from the health department. Michaela and Joanne, thank you for filling in for us today. And now we'll go to the city of Flint for an update. Kiana.
Yes, hello, good afternoon, everybody. Happy Friday to you all. Wanted to first start with the summer camp, the Campfire Summer Youth Camp that's coming up here in the city of Flint. It will start for our young ladies on July 11th and go through the 15th, and for the gentlemen on July 18th through the 22nd. Now those applications are rolling in, but we still have the opportunity to apply. So you can go to the city's website, cityofflint.com, in order to find that application, or you can email Deputy Chief Edwards Clemens at cedwards-clemens@cityofflint.com. If you don't get to any of that, you can give them a call. The contact number is 810-762-7336, and you'll get all the information you need. The camps will run Monday through Friday, 9 a.m. to 4 p.m. So that's an all-day thing for 1 week. And really, really important to know, they will consider young people younger than the age of 12 just based on their maturity level. So if you have a young person who's younger than 12, but considerably more mature and would be interested in this program, please reach out and apply. Next slide. All right, I did mention this several weeks ago. I wanted to circle back to it because I think it's very important to note that water donations from Ice Mountain parent company Blue Triton will continue in the city of Flint until December 2022. So at each of the help centers, that's Bethel United on Ballinger, Asbury United on Davison, and Greater Holy Temple on Dort Highway, their food distributions and water distributions begin every Monday, Tuesday, Thursday, respectively, at 10 a.m., but the lines certainly form earlier. But the water will continue to be donated there at distributed at no charge. So if you are still looking for bottled water, you have the opportunity to go over to the help centers and pick that up through the end of the year 2022. Next slide. And then just another update, several weeks ago, the mayor announced that the city would work with the prosecutor in the county to create the city's own witness protection program. And so that is very good news for the city because we understand that there are a number of people who would like to share information on things that happen in our community, but are concerned about their own well-being, and rightfully so. And so more information will be coming forth about that initiative. But in addition to that, the City of Flint Police Department has created an anonymous line for non-emergency crime tips. So residents are able to call into this number at 810-237-6957 and give tips about crimes that are happening in the community. Just a reminder that this is a non-emergency line. So if you have an emergency, please still call 911. But if it is something that you can share that is not an emergency, you can give a call or send an email to flintpolicetips@cityofflint.com. And there's someone covering that line 24 hours. And that's it for my updates this week.
Thank you so much, Kiana. We appreciate hearing the things that are going on that help us, because when we talk about health, one of the things we know is health is more than the absence of disease. We bring all of these other aspects into our conversation around health and well-being. As we prepare to close our session today, I am going to ask one more time. So Dr. Deborah, I ask you one more time to come back and just give us one of those really, really, really powerful tips that you always share with us.
Just any old specific tip, Yvonne, just anything.
You know what I'm talking about.
Today's been an interesting day. We didn't talk about some new news that came out about the overturning of Roe v. Wade and some of the other things. I'm in New York. They've also yesterday overturned some very important legislation that will basically put more guns on the street. The need for this kind of information, credible knowledge sharing. I love that Dr. Wolford shifted from a medical moment to an epidemiological moment. Us bringing to bear the power of community voice, data, strong evidence, good science, good medical practice, good public health practice is important. And we all have a say in that. So again, I'm encouraging people, you have a voice and that voice matters. It starts first in how you demonstrate and model and embody that in your own life. I can tell people to wear a mask when they're out, indoors or in crowded situations all day. I also have to model that same behavior and do that myself. So I'm just encouraging people, for anybody who's sort of seen or experienced some of this stuff, be encouraged. Know that you do matter. You have a say. Knowledge is power. And I just remain committed that this great conduit for knowledge sharing is a place where people know they can come and get highly credible, trustworthy, valid information that they can use as tools to keep them and their community safe.
Thank you, Dr. Deborah. A perfect segue to the close for our session today, which is our community health workers and our social workers have an opportunity to get their credits. And so as you are our credible voices that go out in the community, please make sure that you stay on and complete that survey so that you can get your credits. And we encourage you, those of you that listen to us, as Dr. Furholden has just said, we want more information to be available to you because your voice matters. Send those questions in so those questions can be answered by our community representatives. So like us on Facebook, subscribe to our YouTube channel, Healthy Flint. And if you have any questions, email them to us at info@hfrcc.org, or you can always give us a call at 810-835-2130. And we'll look forward to seeing you right here next week. Thank you for joining us today for the Flint Community Webinar on coronavirus.